our Steve Harrigan, who really, again, I apologize, another aircraft has come in, has been the soul of Fox News this week. He has done a magnificent job. Before the commercial break, Greg was interviewing an Israeli doctor. Let me just give you a list of the other countries who've made contributions here, albeit not as grand as the United States. Argentina, Brazil, Canada, Spain, Mexico, Nicaragua, Colombia, France, and the Israelis. And let's go on that note back to Craig at the Israeli Field Hospital. By the time you come back to me, the plane will have shut off its engine. Craig, take it away.
Harold, yes, Harold, we're in the pediatric ICU. This unit is taking care of a number of children who have suffered severe injuries as a result of the earthquake, mostly crushing injuries. But it's not only the injuries themselves, it's the fact that the injuries have not been treated for days and days. They've been out in the streets, not able to get the kind of care that they really needed. And the Israeli doctors, all of them volunteers, about 40 of them are here giving them the best of care. Colonel, tell me about this patient, 12-year-old boy.
12-year-old boy with a tibia fracture, was in the streets for 3-4 days, and now he's here. Tomorrow he's going to be operated.
And you have another 13-year-old. This young lady was just operated on today. We don't want to expose the injury, but it was a severe fracture to her leg.
Femur fracture.
And how close have some of these children come to death as a result of their infections, not just the crushing blows?
This is a kind of injury that if you don't take care of it for a few days, they get infected, and it's a life-endangering situation. But if you come here and just take a treatment, very simple treatment, they can save life. We can save life.
And if you pan around, Greg Hart, we can see that this particular unit is filled with children, parents sleeping by the sides of their cots. And not only is it just the pediatric ICU, they have a neonatal unit. There was a young child, just how old is a 3-year-old child that came in that was ill?
We have the 3 days child here with a severe hemorrhage that we took care of him. One of our physicians took blood from his own and gave him, because he had lack of hemorrhage, some kind of coagulation factors.
The doctor's blood type matched that of the young patient, so the doctors aren't only giving their time, they're giving their own blood, literally. And they have the most elaborate equipment here. They have x-rays, they have, describe some of the equipment that you have.
We have intensive care unit, operation room, we have a lab, we have imaging department, we have hospitalization departments, emergency room, and also pediatric care unit. And we have a gynecology and delivery room.
So you have a delivery room right here, and you have a number of pregnant women who have come in with injuries as well. And not only that, Harold, they also have their own search and rescue unit. In fact, 3 of them. And just today, their search and rescue unit brought in a 45-year-old who was trapped underground for a number of days. Tell me about that.
He was trapped, and he is alive, and he's not so severely wounded. He's here, and he's going to be well. Maybe tomorrow, the next 2 days, he can go home.
So they're operating on a 24-hour basis, and there are some empty cots, however, but that has to do with the security issues. People are afraid to go out into the streets at night. They're having difficulty getting around. You know, there's no gas. There's a lot of cars that have been completely destroyed. So it's very difficult to get here, but once they do get here, they have the best of care for all of them.
Okay, thank you very much, Craig. This is Dr. David Gettle. He's with the Samaritan Purse. He's the lead doctor.